Good morning once again, and welcome back to K24 Alpha G. It's now time to rise and shine. This is exactly what we do every day from 6:30 to 7 in the morning. And as you know, today is Wednesday, and our main focus on Wednesdays is wellness. That's why today we are going to be talking about preventive measures and curative measures when it comes to wellness. Joining me in this conversation is not a stranger to the K24 Alpha G team, Maina Azimio. Karibu sana to K24.
Thank you.
We are happy to have you. It's been a minute, eh?
Sure.
Yes.
It's got some time.
Yes, and the last time you're here, we spoke about financial wellness.
Yes.
Today we're talking about something totally different.
Health.
Health wellness.
Yes. Thank you.
For the people who are tuning in right now, please just tell us what you do.
Okay. My name is Maina Azimio. I am a wellness trainer. I coach people on how to take care of themselves.
Okay.
Because when we came to this world, God had a purpose for all of us. But there are distractions that comes along the way that we are not able to come up to our best and to be who we can be. So I did some research and I found that there are 4 areas that are limiting us from becoming the best we can be.
Okay.
Our health.
Yes.
Because your health is your wealth.
Absolutely.
So you can't do much without health. So after health is our mind, because the way we conceive our thinking, we manifest what we think. Then we need resources. That's what we were talking about the time I was here. The money, the financial wellness. Then we come now to emotions. Emotional wellness.
Yes.
Are you happy? Are you sad?
Yes.
Are you fearful? Are you courageous? So it depends on what emotions you emit. So we combine all these 4 in Azima Wellness Consultant and train people how you can be able to navigate through these 4 areas and you become the best you can be.
Okay.
I am also a Rotarian in Rotary.
Oh, which club?
Rotary Club of Gong Hills.
Aha, okay.
And in Rotary this year, we are saying be the inspiration. And that's why very early in the morning, I'm with you now, so that we can be able to inspire people.
Absolutely.
And inspire them to become the best they can be.
Yes, and today is just all about taking care of yourself. And I was so happy when you mentioned to me that, you know, you were at the gym before you got here.
Yes.
That is impressive.
Yes. So that's the first level you do, because we are made for activity.
Yeah.
We are made as hunter-gatherers. A hunter and a gatherer, what they do is that they run in the field to gather food. So, so if we stay without activity, it becomes a problem. Sedentary lifestyle is one of the biggest problems we're having in our lives. So what I do is that every time I wake up at 3 a.m., between 3:15 and 4, I'm in the gym.
Wow.
Yes. Then, then I go to my study to be able to prepare my day. Then 5 a.m., I get my breakfast. Then I leave.
Okay.
So always, every day, I have to make sure that I have done 10,000 steps minimum.
Wow.
10,000 steps.
Yes.
I've got a smartwatch that measures how many steps I have taken in a day.
Each and every day?
Yes. If I get home before I've hit 10,000, I'll go to the gym. I did a house gym when I was doing my house. So that's one of the good things I did for myself. So I'm able to get to the gym when I want. And I have a program that I always follow. And I want to tell you to do the same.
That is quite impressive, because I'm just imagining how many young people actually get to wake up at 3 to go work out, you know.
Very few.
Or how many of us we actually get to walk and exercise on a daily basis.
Most of us are living a sedentary lifestyle.
Yeah.
And that is why the problem we are having right now. You've been seeing on the news that we are having a lot of congestion in hospitals.
Absolutely.
This congestion is not caused because of contagious diseases. No, it's lifestyle diseases. And lifestyle diseases is caused by our behavior patterns. So the way we are behaving is the cause of these diseases.
Yeah.
They are draining our economy dry.
Yeah, absolutely.
So we need to stop this.
All right.
The middle class in this country is the biggest culprit in this. Because the way we are eating, and we are sedentary. We buy a car, you drive your car.
Yes.
From the house, you actually don't do anything.
You jump straight into the car.
Yes. Then you come into the office, you are seated most of the time.
Yes.
When you are upflow, lift. So even when you want to go to the bank, you drive. So you do not walk. Then we park our car just next to the office. I normally advise people that if you are working, if you are coming to work in town, park your car about a kilometer away and walk to the office. And you walk again to it.
And you walk back to it, okay.
Because you have to be deliberate.
All right.
Then make sure that you join a gym if you don't have any, or even just buy a skipping rope.
Okay.
Make sure that in your house, when you wake up in the morning, work the body out.
All right. And that is all about wellness.
Yes.
But before we delve much deeper into this conversation, I'll just like us to help our viewers understand what is wellness.
Yes. You see, people normally confuse wellness and health.
Health, yeah.
Because these are 2 different things. There's healthcare and there's wellness. See, healthcare is bigger, in a smaller, is a smaller pillar of wellness. Because wellness is the process of learning about, and engaging in as a pattern of behaviors that are likely to lead to optimal health. It is in the dictionary and Wikipedia. That is the definition. So, but health is being in optimum health in your body. So what we do is that in wellness, we are looking at how we can do preventive healthcare instead of curative healthcare, which is actually called Medicare. You are using medicine. Or we call it the sick care. So the question is, you must get sick for Medicare and sick care to come in. But you can have healthcare and wellness before you get sick.
Okay.
Like now, personally, I had mentioned to you earlier, during my young days, in fact, up to 2012, I used to be 96 kgs. 96. And I was being told I'm good. My mom was very happy that her son is doing well. My wife was feeling very good that she's cooking well for the husband. But when my doctor told me that when I was turning 50, he told me that I'm overloading my body organs and I'm not supposed to be there. Give me BMI, ideal weight, what I'm supposed to be. I decided no, I will not live at that level. So I went to the gym, worked out purposely, and I brought my weight down. Since then, I became very energetic. I became a hiker. I have done hiking in most of the mountains. I have done Mount Kenya, Mount Kilimanjaro, Mount Rwenzori. I'm going to Everest. I even did Rockies in America. I have done Swiss Alps. Hiking I have done properly.
Impressive,
because the energy I have now. Now, what we do is that in wellness, we help people to be able to get their body working optimally so that you can live a longer life. We are living up to 120 years nowadays.
Absolutely.
It's you have senior citizens in this country. Georgia is 98. Just 2 years to be 100 years.
100 years.
Yes, Mo is 94. You know, he went to Israel and had an operation and came back. The guy is good. He was meeting our president the other day. So the award is 90. So we can live many years. But the majority of the middle class are dying at 65, 70.
Because of our lifestyle. And that is exactly what we need to change. And it's important that you have brought good health into this, because people do not understand the difference between wellness and good health. Because there's a huge difference between the two.
And this is what we want to unpack. We want to unpack for our people. You see, wellness is holistic, and wellness has got 5 pillars. 5 pillars, wellness. So first and foremost, we have got the physical health. Physical health, how your body operates. God made our body in a very complicated way. But our body thinks on its own. It's able to predict. Like when you sleep, you start dozing even if you don't go to sleep, don't you? You doze.
Absolutely.
When you wake up, if you wake up at the same time continuously, you don't even need an alarm.
Absolutely.
An alarm is only necessary. Like now you know because you're an early riser. When that time comes, off you go.
I'm awake,
When it's time to eat, your body asks for food. You get hungry and even get thirsty. So that is how our body is. Now, if you get used to exercises, like now personally, if I don't go to the gym, I feel very tired. I'm not able to operate well. So the body has its own mechanism of operation. So if you're operating at that state where you are listening to your body and doing what your body wants, you will now be able to get to that state of wellness and you'll avoid diseases. I can tell you today that since 2013, I reduced my weight in 2012. Since 2013, I have never gone to hospital.
2013?
Yes.
That's 5 years ago?
Yes. I don't take medicine. For what? I don't get sick. Yes. I eat well. I eat organic. I don't take actually food which is laced with chemicals unless I travel. When I travel, there are places you cannot get anything. I was in America last month, and in California, I was in San Diego for a wellness conference. Because Azima Wellness Consultant is a known brand in wellness. We train people on how to behave well and how to live well. So we were invited for a conference in San Diego of behavior change. So in San Diego, it's very good. There's a good ecosystem because all what you need to do is to Google which are the hotels which are selling healthy food. And they are doing it very seriously there. That was okay. But when I came to Oklahoma, because from California I came to Oklahoma, there the ecosystem for organic food is not well grown. Then from Oklahoma I came to Maryland in Baltimore, because on 4th of July is American Independence Day.
Yeah.
The Kenya community there, they had organized for a get-together, a fun day for Kenyans. You know, Kenyans in Nyama Choma. I was shocked.
Always looking for a reason to celebrate.
Yes.
And to have that beer.
It is very good.
And Nyama Choma, yes.
You see me as a wellness trainer, I'll tell you, alcohol is not good. Soda is not good. Nyama Choma is not good for your health. So, you know, when I went to the Kenyan community, they had the muturas and Nyama Choma and everything. And I was just watching, I told them I don't eat this. Why? Because they are not healthy. So I started conversing with them. We are even with our Kenyan ambassador, Jero Gedai.
Okay.
He came for that event. So it was a very good event, and I was happy to interact with Kenyans so that I can also share this message of wellness with them.
Okay.
And they have invited me to go back there again so that we can now talk this in depth. And I'm in a good conversation.
Yeah.
So here now in Kenya,
Okay.
we sat at home. So what do we do with our Kenyans? We want to tell them that healthcare and wellness are not the same.
Absolutely.
So wellness is health, then we come to mentor the way you think, because if you think that soda is good, you'll take soda.
Very true.
If you think a cake is good, you'll take a cake.
You will take it.
Yes. If you think sugar is good in your tea, you'll take it.
Absolutely.
So it's the mind that determines you.
All right. So let's go back to a point that you just mentioned as we were starting this conversation, and the congestion in our hospitals.
Yes.
And it's crazy because the other day I was watching this video, and I don't know whether you did have a chance to watch it, in Kiambu County, Kiambu Level Hospital, where it was congested. Like one bed was being shared amongst what? Four people?
4 people, yes.
Yes.
See,
and the governor said, you know, that's better than what? Not having anyone in the hospital. That means there are good services there. Which is quite a sad situation.
That is a point of desperation.
Yeah.
Because even our healthcare, our leaders are actually at a point that they don't know what to do next. The facility has been stretched to the limit. Bad thing is, these diseases which are making our hospitals get congested are not contagious diseases. They are lifestyle.
Absolutely.
In fact, our bed occupancy in hospitals, 85% is actually on lifestyle diseases. The contagious diseases, we have been able to control them. With the technology and hygiene and the development that we have done, we've reduced now the diseases that used to kill our people. Good example. In a Rotary, we have done the campaign to eradicate polio in the world. Polio. In fact, last year, we were in a conference in Atlanta, Georgia, and we had only 5 cases of polio discovered in the world in 2017. So this year I was not able to go to Toronto, Canada, because I was in the same time that going on. We are now in the States. So, but we have been able to work very well to reduce polio. You see, malaria. Malaria nowadays is not a very big issue. Though Kenya, I'm sorry that we are importing doctors from Cuba.
From Cuba now.
Because it is actually too much for us. So we Kenyans need to take up this measure to see how we can prevent ourselves from getting that. In fact, even if we increase the hospitals and we continue doing what we are doing, we are not going, our rate of getting sick is higher than the rate of the government ability to construct hospitals for us. So what do we do here? A lifestyle change. If we did the right thing, we'll not need to go to hospital. I have told you that I'm on my 6th year now without going to hospital. So if most of us do that, we are going to reduce the need to go to hospital. Okay. Remember, the medicines that we are treated with are important.
Absolutely.
Yes, even small things like gloves, hygiene things, gloves,
and syringes, by the way.
And needles.
Putting all these things,
and needles. So there's a whole confusion that we are going through because of lack of knowledge. The Bible says, my people perish because of lack of knowledge. So thank you very much for inviting me so that we have this conversation. We tell people that, hey, you can change your lifestyle. You can change your narrative. You must not get sick. In fact, I tell people when we are training that you do not need Medicare. What you need health care. Absolutely. Because health is when you are preventing yourself, because wellness is the anchor of all of them. Absolutely. So the first level is healthcare. Then those who are already sick, they go to Medicare because you have to be treated to reverse these conditions. But we can use food and exercises and environment, because again, if you're living in a polluted environment.
Absolutely. We are cutting down trees.
Yes. And you're not planting.
We are dumping bottles and plastics in our rivers, and it's just so sad that, you know, we are completely just destroying this planet.
In fact, Kenya middle class again, and I'm always at the middle class because that's where I belong, and that's my constituency. We need to take this gauntlet and educate our people. I have been telling people that because they used to complain that the government banned polythene papers. it was the best thing that could ever be done.
Absolutely.
Because it is a world we were destroying, and we do not have another world that we can go to.
Absolutely.
Wangari Maathai said, nature does not forgive. If you mess with environment, when you start hitting back, it will not stop.
Absolutely.
This is what is happening.
Very true.
So it is upon us to reason out and see that we got to change our behaviors, which are destroying our environment, the only place that we call home. If we continue this way,
Absolutely.
the respiratory diseases that we are actually getting is because of our actions.
Absolutely.
So wellness is holistic.
It's, yes.
And we do it all.
absolutely. Yeah.
And this is...
And is it so sad that now people are taking political sides when it comes to an issue like the Mau forest?
But
And
it's very sad. It's lack of understanding, lack of knowledge. Because they look at the personal issues.
Yeah.
Is it like corruption in this country? Sometimes I sympathize with our president. Because he's working very hard and trying to make sure that Kenyans are moving forward. But corruption is actually drawing us backward. Drawing us backward. He gives people positions of authority. And even go and negotiate for money to come and jump us off. But instead of now running the activities of government as their own, with a point of ownership, they are stealing. And even taking money abroad. Last week, but one, we were told that the money that is kept in Switzerland increased by 4%. So that means we are spiriting away money when the president is all over borrowing money for infrastructure development.
Absolutely.
So this corruption, like the one that's happening in Mau, people are thinking about their own kashamba to do their own food, but not the environment. We cannot run our country this way.
Absolutely.
Our ecosystem is very important.
Yeah.
The bigger picture, what world are we going to give to our children? Surely. The Indians say the world we have is not a gift from our grandparents. It's a loan from our children. So the question is, how would you want to give this back to the children? You borrowed from them.
Okay.
And it is not right for us to borrow from children.
Absolutely.
We should give it to them.
Absolutely.
But we have the world as a loan from our children. Let us take good care of it.
Okay.
Yes.
And by taking good care of it, what exactly do you mean? What are we supposed to be doing, Maina?
In taking care of the universe, we are supposed to make sure that all the contaminants, because we call first the air. Do you know that our food, number one, is air? 96% of our food is air. Because if you don't breathe, by the anything else you can live without. But if you even close your nose and your mouth, you can't go 5 minutes. You'll fall dead.
Absolutely.
So air is actually very important. Oxygen. Oxygen is produced by plants during photosynthesis.
Photosynthesis, yeah.
Then we human beings, we exhale carbon dioxide, which the plant
use.
So it's actually, we depend on each other.
Yes.
So without trees, we are done. There will be no oxygen. And without oxygen, there's no life. So we and plants coexist. And this is why God placed Adam and Eve in a garden, not in a city. And God had the ability to say, a city comes up. You were just mentioning and things were coming up. But he made a garden and put Adam and Eve.
Yeah.
Now, if you look at it, we have gone destroying forests. We have gone destroying trees. In America, by the way, in towns, in the cities, they have got forests. You know, after every few kilometers, there's a forest because they understand the ecosystem.
Absolutely.
And their planning is very good. Here in Kenya, even Ngong Hills, even Ngong Forest, we are destroying. So this is a concrete jungle.
Absolutely.
And when we do that, we are now reducing oxygen that is coming from plants.
Absolutely.
Then our waters. We can't live without water. Because the second from air is water.
Yes.
When we pollute now our rivers and our oceans and our water sources,
we are
with those
dumping
papers,
everything in there. Yes.
The bottles. Nowadays, I stopped taking, even anything that is on plastic bottle. I do not take it. Because when you take those plastic bottles, there is no system in the Kenya how we collect them and dispose of them. They all end up in the waters. And you see, the water that even our rain, it's actually now the same water that flows up.
Yeah.
See? So if there's pollution here, everything that comes up is...
Yes.
So it's all happening.
Yeah.
Plants cannot grow well in a polluted environment. Plants.
Absolutely.
Because the water we are using,
Yeah.
it gets to the plants, then we feed onto them.
Okay.
So the question is, what are we doing to ensure that the food that gets to our dinner table is fresh and it does not have impurities?
Absolutely.
We are using so much chemicals to grow food. It is spoiling our skin. We are inhaling it. We are eating it. We are ingesting it.
Yes.
So we can't be who we are. Let me remind you, in the good book, the Bible says that our body is a temple of the Holy Spirit.
Yes.
temple of the Holy Spirit. So you can't be destroying God's temple and you go to church. First, preserve this temple he gave us to take care of. How do we do this? Environmental protection. Okay. Wangari Maathai had a very strong point. Most of us did not understand her properly that time. I did. And I worked with her very closely. And that's why even I refuse to stay in Nairobi. Okay. I stay in Gong where I have got a forest. Absolutely. Around my home. And you can preserve it. Yes. Okay. And we cannot end this conversation without talking about insurance. Yes. How important is it? Wow, that's a very good point you have brought in, Sarah. Because yesterday, Business Daily, it said that 14 of the listed companies in Nairobi Stock Exchange, they spend 3.7 billion Kenya shilling. 3.7 billion? Yes, to pay for medical for their staff who are insured. 3.7 billion, only 14 companies. What is this telling you? That staff, and you see these are middle class actually, they are getting sick, going to hospital. And that's why. On a daily basis? Daily, yes. Yeah. And can you count man hours? Man hours lost? Because when somebody is sick, in fact, now the insurance, what they do, they normally pay for the inpatient. Yeah. Outpatient, most companies have got hospital, they have appointed that their staff now go there. But when you hear the insurance paying, you are hospitalized. You didn't come to work. Today, if I came here, I didn't get you, we don't have this conversation. So we need you at your optimum health to be able to run Alpha Jiri, to run this show. So I have to be in good health to be able to wake up early and come here. So we cannot be able even to inspire, we cannot be the inspiration as the calling we have in Rotary this year, that will be the inspiration if you are unwell. Now, insurance does not give you an express permission to become reckless in your life. Absolutely. Because some people say, because I'm insured, I do what I want. It's okay, I'm fine, yes. I'll just walk in and get the treatment. Let me ask you, you drive. Yes. Your car is insured. Yes. Comprehensive. Yes. Do you become reckless on the road because you're insured? Absolutely not. And why your health? Because I am wondering, I normally talk to my people that, surely, why do you eat junk? When you eat junk, you are intoxicating your body. When the body becomes toxic, you're going to get sick. You need to have an alkaline acid balance in your body. Diseases do not exist in an alkaline state. And the foods which are alkaline, we teach people in Azima Wellness Consultant and show them the foods which are alkaline in nature. Taking water which is alkaline. So making sure that you are exercising and you are sweating. You know, when you sweat, you detoxify. You make the body actually operate at an optimum level. Health is becoming a very big issue. From the moment that Waitito is talking that it's better for having 4 people instead of having no people to take care of it. People, the kind of money that is going in there, the insurance companies, the government itself, the money they are allocating. Our president made among the big 4 healthcare. Absolutely. It's a very big issue. Yes. Our first lady, Madam Margaret, she's doing a very good in the campaign. With Beyond Zero campaign. You can see there's so much being done, yet we are not winning the war. Absolutely. How do we win the war? Azima Wellness, we are here to say that if we are not going to prevent curative, we are not going to make it. The medicines we take when you are sick, they make the body toxic. Because the carrier material is chemicals. Those chemicals make the body toxic. Insurance are feeling the pain of paying hospitals because that money does not come to us. Even we can even say here between me and you, and we're not going to shout loudly. Most hospitals are not owned by us. Absolutely. They're owned by foreigners. Yes. Abraham bought a Avenue nursing home. So you can see now we are losing more when we get sick. And again, there's nothing as good as health. Absolutely. If you do so, exercise. It's healthy. Just make sure that you're taking care of yourself and the environment. Yes. Thank you very much, Mr. Maina, for coming through. That was quite an informative topic to discuss. It has been about preventive and curative wellness. Thank you so much. That was so deep, and I just wish that we can have an hour to discuss this. Call me, I'm available. I will. I'll come in. Definitely. Yes. All right, that's it for Rise and Shine this Wednesday morning.